Hi, everyone. Welcome back. I'm Dr. Samantha, and I'm here for another one of our Monday live Q&A sessions that we have here to answer your questions live. We are really excited to be here. Remember, we're over on Facebook and Instagram for additional content. Those will be linked into the description. Also, remember to share the channel with your friends and family. And please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. For those of you who hang around until the end, I will give you a sneak peek at tomorrow's video. And it's really important, if you want, to go ahead and subscribe and hit the notifications bell, and then you will be notified when our content comes out. We are a part of the YouTube Health platform. For those of you who are not aware, this is an area of YouTube where they've gone ahead and tried to verify content creators like myself. And they make sure that we are legitimate providers with legitimate education, so you can be assured the information that you are getting is coming from a healthcare provider. So we're really excited to be here. Thank you so much for joining me. As usual, I start out with answering some of the questions that you guys have that you submitted over onto some of our videos this week. So I'm going to go ahead and get started with those. But remember, if you have any questions, please feel free to put them into the chat. So we had a couple questions, and it started with a question that actually came in on my superfoods video, and it said, I'm pregnant and I have hepatitis B. Should I eat any specific foods to help heal? So this is a great question to start out with. For those of you who aren't aware, hepatitis B is actually a sexually transmitted disease. And it is a disease that we actually receive a lot of. Our babies receive 3 immunizations starting actually at birth, if you choose to vaccinate right away. And this helps to protect your baby from the hepatitis B virus. Hepatitis B, one of the things it will do is it will attack the liver. Now, there is no cure using foods for hepatitis B. There is no cure or food that would help with that. However, with hepatitis B affecting your liver, one of the things you might want to do is actually eat a lower fat diet, because fatty foods really hit the liver hard. That's why we have something called fatty liver disease. And you also may want to go ahead and work on a lower inflammatory diet. So inflammation creeps into our body and it does a whole bunch of things that aren't good for us. It can cause a lot of our pain. It can cause mood issues. It can actually cause us to not sleep well, to gain weight. Inflammation is very much a hidden disease that is plaguing a lot of people. So a low inflammatory diet includes stuff like limiting the amount of gluten that you eat, eating less inflammatory foods like nightshades. Nightshades include tomatoes and peppers and stuff like that. So if you do have hepatitis, putting less of an inflammatory load on the liver, because the liver is a very important part of your detoxification system, that can actually help to, hopefully keep your body in order. So that's one of the things that you can do. So that's a great question to start out with. So the next thing we had a couple questions on my yeast infection video. So yeast infections are extremely common during pregnancy, and it's very important to get them and any other infection that you have treated properly. Infections are one of the number one causes for miscarriage, preterm birth, stillbirth, unfortunately, and different complications with the baby, like difficulty growing and stuff like that. So whenever you have any symptoms of an infection, you want to make sure you let us know. Now, one of the common symptoms for an infection is actually discharge coming from the vagina. So we have a lot of discharge that can be normal. So normal discharge during pregnancy can be a clear kind of discharge. However, if it has any type of color to it, that probably means you have some kind of infection going on. And you also might have some bleeding. Bleeding is one of the most common questions that I get asked, like, why am I bleeding? Is this normal? And one of the things that actually can cause bleeding is infection. So when you have an infection, it can cause the vagina to be really, really raw, and then you bleed. Hi, Chris. Thank you so much for joining. So starting out with some of the questions. I'm 29 weeks pregnant and I have yellow discharge, but there's no itching. What should I do? So this is an example where we start out and we see this is somebody who has a discharge with color but no symptoms. This needs to be looked at right away, because what we're going to do is we're going to go ahead and we're going to swab you. So what do I mean by swab? We take a sterile swab. It looks kind of like a big giant Q-tip, and it's a wooden stick with the sterile cotton at the end. And we'll actually do a vaginal exam, and we'll stick the Q-tip inside, or the swab, and we'll gather some of that discharge, and we send it off to a lab. From there, we can tell what we are looking at. Is it amniotic fluid? Is it semen? Is it normal vaginal secretions? Is it urine? Is it a viral infection, a yeast or fungal infection? Is it a bacterial infection? All of that stuff. And then based off of that, let's say it's a bacterial infection, we can go ahead and determine which would be the best treatment for that, which antibiotic would work the best. So the starting point is, once you know you have discharge, if you're not sure what you're looking at, please come in and let us test you so we can figure it out for you. Now, a lot of people are they're not really sure, what color am I looking at? Is it a lot? Is it a little? So if you are wearing a pad, you can always take a picture of the pad and show it to us when you get to the hospital, that picture, so we can see what you saw. That does help us identify what we're looking at, and we can answer questions based off of that. Like, is what you're seeing a lot? Is it a little? Was that green or was that actually yellow? So those are things that we can answer for you. So feel free to take a picture. We've seen a lot of stuff in the hospital. A picture on your phone is not going to be that big of a deal for us, okay? And that can actually help us a lot figure out what's going on. So if you're having yellow discharge, you need to contact your healthcare provider and let them know what's going on. They're most likely going to send you to the hospital so we can do the testing that I just told you about. If it's after hours, you can also just go straight to the hospital to be tested. Now, we have gone ahead and we're testing. So the next question that I got was, I have been advised to take a single dose of fluconazole 150 for a vaginal infection. Not itching, but feeling a burning sensation and mild pain around the vagina for one night. I'm 20 weeks pregnant. Then I should take Fluorotal 2 capsule in the morning for 10 days after meals. So fluconazole. This is also called diflucan. Diflucan is commonly used for the treatment of yeast infections. For most women, we give you one dose when you're not pregnant, and that takes care of your yeast infection. So again, one dose at 150 milligrams is the normal round. Sometimes for treatment-resistant yeast infections, you might get a 3-day treatment course, 150 milligrams times 3 days. Now, if you start Googling about diflucan, you're going to see that it's like so dangerous for your pregnancy. And what I'm going to tell you is it's actually not as bad as what you read. So diflucan at high doses, 400 to 800 milligrams, is hazardous for your pregnancy. That is not something that we want to do. But you are able to go ahead and take like 150 milligrams one time, and that's considered safe for your pregnancy. We use it a lot, and we find it to be the most effective. When you're talking about a yeast infection, you need to treat it with the proper medication. A lot of the over-the-counter medications are safe for pregnancy, but most healthcare providers will not necessarily recommend that to you. For starters, a lot of them need to be inserted into the vagina, and if you don't use a proper clean technique, you might actually induce like a bacterial infection. Secondary, unfortunately, we're seeing a lot of treatment-resistant yeast infections. So some of that over-the-counter stuff may not be effective enough versus one dose of diflucan. And remember, if you have a yeast infection, this potentially puts you at increased risk of having a miscarriage or other complications, which is why it's so important for us to get you treated. Hi, Bilquis. So I'm 16 weeks pregnant and I often feel pain during sex. Is it normal or not? What can I do? I'm concerned about it. So this is a great question, and we do get a lot of questions. We actually have a sorry, we actually have a video on sex and pregnancy, and I actually have a question that came in very similar to yours, which said, what happens when I'm going to have sex for the first time 6 months after the pregnancy? Will it be painful, or will it cause any damage to the body? So pain during sex, unfortunately, is very common. It happens for a variety of reasons during pregnancy. The most common is that basically the hormones for a healthy pregnancy actually thin out vaginal tissue. And your vaginal tissue can become thin and dry. And because of that, it often will cause you to have pain and when you're actually having intercourse, as well as sometimes even a little bit of spotting. And so one of the things that you can do is you can actually use a lot of lubrication. It's extremely important that you're moist during you're moist and you're turned on during sex. And we actually have a couple videos that we put out on sex during the 3 trimesters and what are the best positions for sex during those trimesters to help make it less painful. Because that's the second part. Once each trimester comes with its own things, but as your belly's getting bigger, there are certain positions that actually may be more comfortable. And it is still important for you to actually be ready to have sex, to be turned on and stuff like that. Because when we're turned on, there's a whole bunch of blood flow that goes to the uterus. And when that happens, the uterus kind of softens up and that helps it to make it less painful. Now, you might also be having pain depending on what's going on after an orgasm. And that's because you may have some contractions of the uterus, and those contractions may actually be causing some of that pain. What I will tell you is you always want to let your healthcare provider know, because I actually have a video on a very specific type of infection called ureaplasma. And ureaplasma is actually a little bacterial infection. It's not sexually transmitted. It can be passed through partners, but it's like a skin bacteria, basically. It actually needs to be treated with antibiotics, and it is a very common cause of preterm labor, and it's also a very common cause actually of pain during sex. So what I tell you, Bilquis, is you want to go ahead and talk to your healthcare provider to make sure they do that swab I was just talking about, and make sure you don't have any kind of infection going on. Okay, Chris, is a subchorionic hematoma near the cervix mean more bleeds? Bleeding settling down, no more hemorrhages. 13 weeks pregnant, hematoma was diagnosed early. Still on pelvic rest. Okay, so this is a good question. So let me explain a couple things for those of you who might need a little bit more to this, okay? And I actually have a question on subchorionic hemorrhage, which said, I had another user who came on and she said, I had my first scan at 5 weeks and the doctor said there's a little bleed inside, but I don't have any symptoms or cramping. So what is a subchorionic hemorrhage? And then more specifically, what is Chris talking about? So you have your uterus and then you have your cervix is at the bottom. And a cervix looks just like this, long, thick, closed. And when your cervix opens up and dilates, your mucus plug comes out. So the mucus plug, you have to have a cervix that can dilate. So the mucus plug basically sits in this slot, and it's mucus to try to prevent bacteria and stuff from going up into the uterus, which could cause an infection. So this almost perfectly represents what that looks like. And actually, just so you guys know, this is kind of what a cervix feels like when you're not getting ready to have a baby. Okay, so then you have a placenta. The placenta is supposed to attach to the uterine wall. This side of the placenta is a whole bunch of blood vessels, and this side of your uterus is a whole bunch of blood vessels. And they connect together, and this becomes the organ that feeds your baby. The umbilical cord comes out and goes into your baby's belly. We put oxygen and nutrients in, and it takes out carbon dioxide and toxins and puts them into our body to filter out. So that is what your placenta does. Now, what is a subchorionic hematoma or subchorionic hemorrhage? So this is full of blood vessels, okay? Now, if anybody knows, if you've ever hit your knee, hit your foot, hit your arm, you hit it and then you get a bruise. So a bruise is that black and blue that sits under the skin. That is broken blood vessels. Now, here's the interesting thing about your bruise. It starts out big, and over time as it heals, it gets smaller and smaller. Subchorionic hemorrhages, what happens is they start out as a certain size, and over time, they start to get smaller and smaller. But also, your placenta, which starts out small, gets bigger and bigger. So this subchorionic hemorrhage that maybe at one point in time took up most of your placenta eventually becomes really small. You see how that goes? Now, for Chris, for a subchorionic hematoma near the cervix, that actually sounds to me like you might have a marginal placenta previa or a partial placenta previa. So we have a video on this, but a placenta previa, a complete, means the placenta formed over the cervix. Partial means only part of it's over the cervix, and marginal means it's right next to the cervix. Now, this subchorionic hematoma, if it's at the edge of your placenta, sometimes you'll have some blood that leaks out, and it leaks out and you see some bleeding. So a lot of times when women are bleeding in the first trimester, they go to, even the second trimester, you go to the doctor, they do a scan, like our other question, the 5-week question, who got a scan. And what we'll see is this pool of blood, subchorionic hemorrhage. That's the cause. And we just move on. We just wait and see what's going on with it. Okay. So, one of the things you want to do is you want to make sure that you're like monitoring the bleeding and stuff like that. Now, the hematoma, if everything's settling down, it's probably going away. Most of these will actually resolve, and it's because the same thing. It could stay, this could be your placenta. This is your subchorionic hemorrhage. Right now, it's huge compared to the placenta. But then as the placenta grows, this same size, this is tiny. And so that's what I mean by they resolve. And a lot of them will disappear. So you probably don't need to worry about anything. Now, there is one other thing I want to say about this. A lot of women who experience something like a subchorionic hemorrhage, they will have bleeding, right? So then the bleeding stops, and then even 3 or 4 days later or a week later, they start bleeding again, and they assume it's the same thing, and they don't say anything. If you guys ever have bleeding that stops and then it restarts, you always contact your healthcare provider every single time. Don't worry about being the boy who cried wolf. Don't worry about whether they believe you. You just keep reporting, because it could be something different and you don't want to ignore something that's going on. So Chris mentions she's on pelvic rest. And I can't remember if I have a video on this, but pelvic rest is not bed rest, okay? So pelvic rest is where you are not allowed to insert anything into the vagina. That means no tampons, which you shouldn't be using a tampon during pregnancy anyway. No douches, no toys, no fingers, no medicines, no sex, nothing. Okay? Pelvic rest usually also means you can't have an orgasm. Basically, you want to leave the pelvis alone and the vagina alone to help prevent any type of infection or any irritation that could lead to more bleeding. So I just wanted to clarify that for you guys because pelvic rest is extremely important to understand. It's important to understand what your restrictions are. One of the common questions women will give is if they're on pelvic rest, they're told not to have sex. But sex doesn't have to be penetration. It could be toys used on the outside. It could be self-stimulation, and sex often leads to an orgasm. So actually some women are told not to have an orgasm either because the orgasm stimulates uterine contractions. So you have to ask. During a pregnancy with no complications, having an orgasm is totally fine. In fact, your baby likes that little bit of contractions it will feel. But if we're having a complication, sometimes we're not able to do that. All right, Swad. I'm 12 weeks pregnant and I'm struggling with yeast infections and it's painful all the time. My question is it safe to use apple cider vinegar? So, apple cider vinegar is a treatment that is used by a lot of women for this. Absolutely do not use this during pregnancy. So, yeast infections are tricky little things, okay? One of the problems with yeast infections is that what it means by its definition is that your vaginal flora is off. The bacteria that's supposed to be there isn't there the way it should. You've got too much of this yeast and fungus growing, right? And unfortunately, treatment resistant yeast infections are on the rise. The problem with the apple cider vinegar is twofold. Number one, the hormones that are there for a healthy pregnancy, unfortunately, they thin out the vaginal tissue. This can leave your vagina already on the irritated side. Now you add a yeast infection, you're even more irritated and raw. Then you add apple cider vinegar. Oh my God, that's got to be painful. Second, it is going to change your vaginal flora. So it's going to take out even more good stuff. And you're going to end up probably with a raging infection of some kind. Now, I believe in homeopathic alternatives. So I'm not against this in a normal situation where you are not pregnant. But pregnancy, I would not do it. What I would be doing is I would be heading to your doctor to figure out what treatment they want you to use. Secondarily to that, what I would be encouraging you to do is to go ahead and you want to take a probiotic. Probiotics are there to help maintain your normal flora. Normal good bacteria needs to be present because you want to make sure that your body is going to be able to fight these things on its own. Make sure your immune system is doing well. And then your hygiene is essential. So ladies, our vaginas are dark and moist. This is the perfect breeding ground for yeast and for viruses and for bacteria. You need to let your vagina air out. This means when you're sleeping at night, go without underwear. If you're walking around your house in yoga pants, go without underwear. They're cotton pants, which means it's going to breathe a little bit more. When you're washing, no douching. Douching is really bad for vaginal health. You can use soap, but don't overdo it when you are washing. You don't want to over cleanse there because that can just make things worse. But you do want to shower every day. You want to make sure anybody who's touching your vagina, including yourself, has washed their hands because our hands are notorious for holding on to all sorts of yucky stuff. And then you want to make sure you're putting on clean underwear every day and just all those good things for good vaginal health. So I hope that helped. You're welcome, Chris. So going back to, I did have another question on yeast infections, kind of going off of this. I suffered a lot from yeast infections, so I'm using probiotics for vaginal health. Now I'm good. My question is, I want to try for pregnancy. Can I continue to use the same probiotics for vaginal health? Please advise. So most probiotics are safe for pregnancy. There's also certain things that you can take from a diet standpoint. Thank you so much, Suad. There's certain things you can take from a diet standpoint, like kombucha and kefir and sauerkraut. So there are some things you can do from a natural standpoint. What I have to say is this. When it comes to supplements, None of our supplements or vitamins are regulated. So if you're in another country, this may not apply to you because every single country has their own standards. But here in the United States, none of our supplements, all those vitamins you buy over the counter, none of them are FDA regulated, monitored, or tested. This includes usually benefit from probiotics. Again, I would definitely give it to them. None of those baby things are FDA monitored. Okay. None of our supplements are FDA monitored. And here's why FDA monitored and tested is important. You don't know what's actually in that vitamin. So, unfortunately, there could be all sorts of ingredients or cross contamination that is occurring and you wouldn't know. An example could be that there could be lead for all you know. There's no way to tell. What I tell people when they're going to pick their vitamins to actually buy the cheapest vitamin out there, which I'm sure a whole bunch of really fancy vitamin makers would hate. But the thing is, those vitamins that you see on the shelves, the vitamins that are the cheapest of the cheap that are sitting on the Walmart shelf, millions of people are buying them and taking them. If they were killing people, we would know it. If they were ineffective, we would know it because so many people are taking them. But when you buy some of those really fancy, really expensive vitamins that only like 3 people in the world take, how do you know what's going on with them? Now, I'm not going to say there aren't some fantastic brands out there, okay? So there are some higher end brands that are fabulous. And so I would tell you that you can always look into some of those. I hate to drop any names because I don't own any stock in any of these companies, but I don't want to look like I'm swaying you to one or the other. So you can actually talk to your primary care physicians or a holistic physician who could tell you some of these brands. There are good ones out there. But again, the cheap ones are usually just fine. Going to this probiotic, right? I can't tell you for sure if you can take the probiotic. A lot of people don't realize that there are certain vitamins and stuff that we shouldn't have too much of during pregnancy. If you guys check out, I actually did a video on prenatal vitamins. I think it's posted. And the best prenatal vitamin to do or to take. If it hasn't posted, it's coming up. I can't remember now. But anyway, that one of the things with that is that it talks about what's good, what's not good, quantities, etc. With the probiotic, there might be something in it that is not good for you. You have to go through each individual ingredient. And just so you guys know, you have to go through each individual ingredient and understand how your vitamins work together. So Chris, speaking about food, is pineapple safe? Pineapple is fantastic. It is one of the best foods I think that are out there. It does have an enzyme in it, bromelain, which might not be great for you, depending on what's going on. So if you are a person who's got like a clotting or like an issue with like clots, so they have you on like heparin during your pregnancy or Coumadin. These are some blood thinners. Or if you guys are on baby aspirin, I have a video about baby aspirin. A lot of women are told to take baby aspirin during their pregnancy. You actually might want to avoid pineapple because the bromelain part of pineapple can actually thin out your blood. And so that could actually be an issue for you if that's going on. And just so you know, there's a couple other things. One thing that's very commonly used is actually cinnamon. Cinnamon can also actually thin out your blood, and that could cause an issue. Again, you guys want to make sure that you know what's in your supplement. I recently had a patient come to me, and she has PCOS, polycystic ovarian syndrome. And this is a hormonal condition that can affect your fertility. It can affect breastfeeding and different things. Well, with hers, one of the things that happens with PCOS is you usually have higher testosterone. She has anxiety, so she was interested in taking ashwagandha. Ashwagandha is a natural supplement that's kind of all the fad right now. It's really out there being marketed for anxiety and stuff. So I happen to know a lot about ashwagandha because I work in psychiatry, but I have a lot of patients who want to use holistic methods. So we talk about vitamins and nutrition all the time, and I really support the use of vitamins for my patients. Ashwagandha actually does a lot of good things. It also can help to lower your blood pressure and lower your blood sugars. It's supposed to be used for anxiety and even sleep. I will tell you guys, I don't have any patients who've successfully used it for anxiety. But one of the bad things about ashwagandha, it actually increases testosterone. So ashwagandha from a female health standpoint is actually not necessarily the best thing. So I actually try to encourage my guys to use ashwagandha, and I kind of pull away from it for my ladies. So that's one thing you guys can take away from that. For foods to eat, I have a video on food and I have a video on ketogenic diet. The biggest thing that I look for is a low carb diet. Okay. Now, everybody's going to say, oh my gosh, we need carbs, we need sugar. Our bodies can't, survive without sugar. Just so y'all know, there's like sugar in everything. There is sugar in green peppers. There is sugar in, or carbs, I should say, in fish, for example. There's carbs in a lot of things. So you don't necessarily, oh, you guys are welcome, not a problem. And please feel free to put any other questions into the chat. Carbs exist in a lot of different foods. It's not just the foods we think about. And so lower carbs, carbohydrates are extremely inflammatory, and all these like processed sugars that we're eating are so bad for us. And so here's the thing also though, if you're gonna eat like sugars and like that sweet stuff, pineapple is a fantastic choice. Mangoes, strawberries, homemade ice creams, different things like that. Stuff where you are eating like a natural whole nutrient type of food. So that would be one of the things that I would tell you about. What about light workouts with a subchorionic hemorrhage? So light workouts, generally speaking, are okay. And most women will be able to do it with a subchorionic hemorrhage because, again, it's kind of like a bruise underneath the placenta. So it's usually not a big deal. Except, Chris, possibly for you. It sounds to me like your placenta is sitting really close to your cervix. So you need to be very careful. So you definitely want to ask your healthcare provider. So if your placenta is sitting very close to your cervix, we sometimes will limit some of your activities. A full placenta previa, again, the placenta is completely covering. This is an automatic C-section, guys. So you don't need to worry if you've been told at like, say, 12 weeks that you have a complete previa, or even like 15 weeks or anything like that. Early in your pregnancy, you can have a complete previa. But as the uterus kind of grows and expands, this placenta can migrate up and off the cervix completely. So you don't need to stress about that. Yes, that's what the text said, not allowed to work right. Yes. Yeah, I figured, Chris, that your placenta was sitting really close to the cervix. So when you have this, right, if the cervix dilates at all, just even a little bit, these open blood vessels can now start bleeding because nothing's stopping them up. And what can happen is actually a hemorrhage for both mom and baby. It's considered life-threatening. So if you're a complete previa in the third trimester, we're actually going to C-section you because we can't let you start to dilate at all. So usually it's an automatic C-section around 34 weeks to prevent any of that. You can't labor because you would just hemorrhage. So this is one of the things. Now, if your hemorrhage is near the edge of a placenta, one of the things that is also considered a life-threatening emergency is a placental abruption. Okay, so a placental abruption means you have your placenta and it starts coming off the side of the uterine wall. This is also a medical emergency because now, as it's coming off, these are all exposed blood vessels. You can start hemorrhaging again. When you have a placenta that's close to the cervix with a subchorionic hemorrhage that's close to that, it's at a higher risk of like potentially becoming a placental abruption. Now, that might change, Chris, as things progress and like if it resolves and stuff like that, or the placenta moves. But right now, it makes complete sense to me why you are not allowed to do any light workouts. So it sucks, but it makes sense. However, do not assume that you should be on bed rest. So just so you guys know, I have a video on bed rest. Bed rest is actually not that great for moms. So our bodies need to move, and just walking around helps prevent blood clots and it helps prevent pneumonia. So while working out might not be allowed, you still might not have to do bed rest, because we now know that bed rest can be really harmful for moms and it can cause other complications during pregnancy. Hi, Lucine. I'm 28 weeks pregnant and my ultrasound shows I have a right lateral placenta. Is this something to be worried about regarding a possible hemorrhage, especially since I'm on 81 milligrams of baby aspirin? So the 81 milligrams of baby aspirin really doesn't cause any type of issues. And sometimes they'll have you stop that towards the end of your like pregnancy, because you just won't need it anymore. And so it's just a right lateral placenta is just when the placenta just basically goes on the right side. Lateral is usually just right or left. It's not really a very big deal. It's just like a position. I'm not really sure why they would have made much of a comment on it. It's just very common. So did they add anything more to that? The other thing, since we're kind of talking about placentas, just so you guys know, one of the other positioning things that you should have, or you might be told, is anterior or posterior. So posterior is towards your spine, anterior is towards your belly button. Anterior placentas are tricky. Anterior placentas will cause you to not feel the baby move as much or kick as much. So moms who have an anterior placenta, usually they don't feel their baby move until a little bit later. Anterior placentas make it also harder to hear the baby's heartbeat. So oftentimes when you're going to the OB and they're having to dig under and stuff like that to try to get the baby's heartbeat, it's usually because you have an anterior placenta. But a right lateral placenta is, unless there's something else about it, it should just be fine. But hemorrhage is usually, we have a video on hemorrhage, but hemorrhages are usually not caused by 81 milligrams of baby aspirin. And again, they'll probably stop it early. And we have a video on baby aspirin. I don't know if we linked it, but you guys can check it out and why some women take it and some women don't, but not everybody should be taking it. I had a question on my baby formula video. So for those of you guys who don't know, I'm a board certified lactation consultant for 13 or 14 years now. I always say 13 and then I get a year older. So it's probably 14 at this point. But I'm very pro formula. So I have videos on bottle feeding. I have videos on formula and then how to make formula as well. So, and actually our video last week was comparing European formulas to American formulas, because that's a big thing right now. So the question was, can I use alkaline or mineral water for baby formula? And the answer is no. I don't care what you read on the internet, just use regular waters, guys. You know, alkaline and mineral water, you're talking about changing the composition and the pH. The alkaline water, the baby formulas aren't designed to mix with those. So you could be altering what the nutritional value is because it's a pH difference. That's what alkaline water is. Then when you're talking about mineral waters, mineral water, it adds minerals or it has minerals in it. So you are actually adding stuff to the baby's formula and you could actually overdo it. So too much calcium. Calcium is a mineral. It's a great example. Too much calcium. Calcium is part of what makes our muscles work. Okay, we think about it for bones, but it actually is a big thing for muscles. If you have too much calcium, you will actually start to get muscle twitches in your face, and you can actually get like this strange feeling, like a numbness in your mouth. You can cause tetany, which is like a muscle issue, and you can actually have seizures. So you don't want too much calcium. Well, again, if you have a mineral water that might have that and you're adding it to a formula that has a very specific amount for your baby, that could actually cause an issue. So no mineral water and no alkaline water. Okay. And feel free to check out some of our videos on baby formula. I think formula is a wonderful option for many families. And I never see anything wrong with it. I had a video on antibiotic use, okay, which is another one that I have a lot of questions on usually. So my OBGYN prescribed cefuroxime Simix 500 milligrams twice a day for 7 days. I'm 15 weeks pregnant. I am assuming that the question is it safe for pregnancy? So cefuroxime is one of many antibiotics that is safe for use during pregnancy. Why do we give those? We give those to treat a bacterial infection. Now, why do I get a lot of questions on this? I get a lot of questions because moms are afraid to take things. They're afraid to do something to the baby, which is very understandable. I can't tell you how many moms come to me. They have anxiety, depression. They've been on medication. They want to come off the medication. They're too afraid to start their medication, even though they are very, very, very anxious or something like that. And it's understandable because we're worried about doing something to the baby. Again, if you have a bacterial infection, which includes a urinary tract infection, this can cause preterm labor, stillbirth, miscarriage, etc. One of the reasons why, and urinary tract infections are a great example, is that when a bacterial infection is left untreated, it can travel into your bloodstream. When you get this bloodstream infection, it's called sepsis. And sepsis leads to organ failure in mom. Now, liver and kidneys help to detoxify our bodies. Mom has to detoxify the baby's toxins as well as her own. So if her liver and kidney starts to fail, she's going to actually have toxins in her bloodstream that are going to go through the placenta to the baby. So we cannot have a woman pregnant when she's septic. That is not a safe situation for her or the baby, which means we have to deliver. So how do we prevent this? If we haven't identified bacterial infection, we need to treat it with medication. So antibiotics, again, one of the most common things that we treat with antibiotics is a urinary tract infection. Are very common because our urethra is little teeny tiny. The urethra is the tube that goes from the bladder outside. It's just above the vagina, okay? Because it's just above the vagina and near the anus, one of the things that happens is we wipe from back the anus to front, all the way up over that to the clitoris, we can actually spread bacteria that can hit this little tiny tube, the urethra, and it goes right up in, and now it's in a dark, moist area where it can start to grow. And so once it's growing, now you've got an infection. And one of the reasons why a lot of women will end up with a urinary tract infection also is because they try a natural remedy. Okay, I am so homeopathic, guys. I promise you, I do so many vitamins and stuff, but you cannot treat an active bacterial urinary tract infection homeopathically. It doesn't exist. Not cranberry juice, not any of these other things you've heard of. Okay. Cranberry juice, for example, is really good to prevent them because it helps to make the urine more acidic. When the urine is more acidic, it's hard for the bacteria to grow. So prior to getting a urinary tract infection, there is some evidence that cranberry juice helps. Not only does it acidify the urine, but it also helps to prevent the bacteria from kind of sticking in there. Another thing that works is I think it is, and I'm losing my mind. I think it is D-mannose. Hold on. Yes, D-mannose. Thank you. I wanted to make sure I didn't say the wrong thing. D-mannose is another supplement that helps to basically make the walls of like the bladder like smooth, so not sticky, so that the bacteria can't stick in there. So those two things are great. You have to be careful with cranberry juice, just so you guys know. You want to get real cranberry juice, like the stuff that comes in a glass bottle and tastes horrible, not like ocean spray that has all the added sugar. Also, if you have diabetes, you may not be able to do that because it is going to contribute. Even the real stuff is going to contribute to increasing your blood sugar. But once that bacterial infection is established, you want to go ahead and take an antibiotic. So when you take an antibiotic, you need to take all of it, not just like the first couple pills, which gets you feeling better. Because what happens is we can develop antibiotic resistance. What antibiotic resistance is this? You have all these lines of bacteria, right? So when you start taking the antibiotic, it starts killing off lines of bacteria. But these guys in the back, they're paying attention. They start building a security wall, and the entire time they're watching this antibiotic and figuring out what it does. Now, if you stop your antibiotic after a couple days because you're feeling better, these guys are just building up that wall of protection. Now, a couple days after that, you start to feel worse. Why? Because these guys called in for reinforcements. So now your bacterial load is higher. So you're like, oh gosh, I need to start taking that again. You take the antibiotic again, but guess what? Now it doesn't work because these guys built a wall of protection. That's antibiotic resistance. So it's extremely important you take all of your antibiotics as prescribed once you start taking them, because that's how it's going to work. If you get antibiotic resistance, now we have to give you a stronger antibiotic. And as they get stronger, there are more risks. Cefuroxime is commonly used during pregnancy. It is very safe and effective. And it's one of the things that we really do find it's very effective and has very little side effects. So, and then, because that was my last question. So if any of you guys have any questions, please feel free. But I'm going to say this also about medications, right? So a lot of people get on the channel and they want to ask about medications. And it's because there's a lot of fear associated with medication. So a couple things. First thing, you have the right to have a conversation with your healthcare provider about risks versus benefits. This is extremely important because risks versus benefits allows you to make an informed decision. The second thing is, if you are unsure about the medication that's prescribed, get a second opinion. You are allowed to do that. Unfortunately, there's a lot of evidence to show that there is bad healthcare out there. Some of you may live in healthcare deserts. This means there may not be a lot of providers to choose from, and therefore you're kind of stuck with whoever's there. Some women experience a lot of issues because of the color of their skin. It is very well known and documented now that African American women are experiencing a lot poorer care than other women. And this also happens for anybody who speaks a different language, etc. So again, you may not be getting the right advice. So who else do you go to? Your local pharmacist has extensive training on medication for pregnant women. So their job is to know all the medications, to know the medication interactions. So if you're not sure what your healthcare provider has told you, please feel free to reach out to your local pharmacist because they can also help you out. So that's what I'm going to say on medications. Does anybody else have any questions? While you guys are thinking about it, let me tell you, you stuck around until the end. Please subscribe to the channel. Subscribing to the channel really helps me out as a content creator. YouTube likes to keep channels going that have more and more subscribers. So really that one little click helps me out. If you hit the notification bell, you will be notified of our latest videos. We have so many videos for you guys to choose from. I'm a big advocate for partners and dads. So we have videos like how to celebrate dads, like great gifts to give a new dad after their baby is born, because dads should get gifts too. We have videos on breastfeeding and formula feeding and C-section and like vaginal birth. Really just check it out. A lot of stuff is there. Please share this with your friends and family. Follow us on Facebook and Instagram for additional content. We are part of the YouTube Health platform, which means you can trust that I am a healthcare provider who got a legitimate education. I had to submit my diploma, my education, and they vetted my material. So I am the real deal. And for those of you who stuck around, remember you hit the notification bell and you can be notified of our latest content. So tomorrow's video is actually a video on something called mommy thumb. So, mommy thumb is a condition that affects your hand and can cause severe pain. Usually happens postpartum. It also happens to a lot of partners and other healthcare providers. So, please feel free to check out the video tomorrow, and I hope you enjoy it. The other thing I want to let you guys know, I am here almost every single Monday at 9 p.m. Eastern Standard Time, here to answer your questions live, but I will not be here next week. One of the things that I pride myself on trying to encourage you guys to do is live a real life, like try to, understand that things happen and life happens. And why are you here? Because your family is one of the most important things to you. You guys are starting families, or some of you starting a family, and you want to do what's right. So next Monday, I'm going to be spending time with my family. And so as a result, I am not going to be live next week. So we will put up a notice. We will be here the following week. We try hard to be here all the time. If you need me, please feel free to reach out onto the channel and ask your questions. And in 2 weeks, we will be back to answer them. I really appreciate all of your support. My name is Dr. Samantha. I am the maternity mentor. Bye for now.